Hi, this is Justin in partnership with Rolling Out Health IQ, and I'm here with Cindy Milligan. Cindy, how are you doing today?
I am doing great, Justin. How are you doing? Thanks for
I'm
having me.
well. Oh, it's my pleasure. Can you give our community a little bit of background on what you do for a living?
Yes, of course. I started my career as I've always been in cardiac care. I was a nurse for 21 years. I moved from Charlotte 10 years ago to the Atlanta area. So in Charlotte, I worked, it's now Atrium Health. So I was there working in the critical care area and then transitioned over into industry. I worked in the industry for about 13 years in cardiac critical care devices, as well as some healthcare IT. So that was a different trajectory. So, nurses a lot of times, try to figure out different pathways. And so there's a lot of things that we can do. And I always try to, explain that to nurses that are at the bedside that is, everything that we touch that we use today in the hospital setting, there is a company or, some type of vendor that you can explore those realms of business. So, that's how I became, got the business sense and getting into the industry back in my nursing years in the 90s, and working with the cardiac device uh, platform. So I moved to working in that realm. I did work for some startup companies, and that is what landed me going back to school to get my master's as a nurse practitioner because I got laid off from one. So I had been into nursing about 19 years and did not see myself in that place at 19 years of being at the bedside and then going back, which is I always stayed PRN to keep my clinical sense because it just helped me keep a good relationship of what the real world was like when I was talking to my customers with the devices that I was the clinical specialist or clinical sales specialist for. So it was very important that I was true to myself and knowing what was going on. As we say, keeping your ear to the ground and knowing what was actively going on. So it served me well in keeping a realistic view of what healthcare was like when I was in those roles. But when I got laid off, I thought, well, let me see, what does the next 10 or 15 years look like for me? So I went back to school to become a nurse practitioner in 2013. And so that's how I ended up here in this role. And so moved to Atlanta because I wanted just a different, somewhere where nobody knew me. I knew all the physicians. I had been at the same hospital for, a long time, about 20 years, and just wanted time, somewhere where no one knew me and just kind of started over. So I can get trained from scratch of, because being a nurse and being a nurse practitioner is very different. It's two different roles to where you're a nurse, and then as a nurse practitioner, it's an advanced practice role. So there you look at the patient from a very different setting of diagnosing and treatment and not giving medications. And you do care plans as a nurse, but as a nurse practitioner, it's more of treatment and diagnosing and more of an advanced thinking and practice setting. So that's why I wanted to relocate. I had family here, so it was just the best thing for me.
And so, why pursue nursing, particularly cardiac critical care? Like, where did that come from?
It rang to me when I was very young. I was 12. My paternal grandmother had a stroke when I was 12 years old, and she was in the hospital. I spent all summer in the hospital with her, and so it was a bittersweet to where I was introduced to the hospital setting at a very young age, where she was had the stroke and she had student nurses. So the hospital where she was at that summer, I actually that's the only place I applied to go to nursing school or to go to college. It was probably a little risky, but that was what I wanted to do. Is go to that same hospital-based nursing programs. They don't even have those anymore. It was a diploma program. So I applied to that nursing school and I got in. They only accepted, I think, 80, maybe I think 85 applicants out of about 365. My guidance counselor told me I would never get in. Yep. And I said, well, just watch, I will. So I did. And it was probably, I probably should apply to other places, but it was just something that drew me to that place because the care that she received, the student nurses that she had, That was just kind of my path that I chose when I was 12, and I never changed my mind. I took health occupations in high school, and that, as they say, that was kind of the rest of the story and how my trajectory went in life.
And so, how has your identity as an African American woman helped you navigate the complexities of getting to where you are today?
It's not been easy in the beginning in those first few years. I was very young when I graduated nursing school. I was 20, turning 21. So it was a little scary. Even in Charlotte in those days I graduated in 1994 in December and started working in 1995, there were times that I would walk in a room and they would ask me, "Where's my nurse?" And I'm like, "I am your nurse." And so and then there were some times that they did not want me as their nurse because I was Black. Yes. So there
Wow.
were some times that, as a young girl of 21 years old, it was some difficult days, and so I would have to go tell my charge nurse, this patient does not want me as their nurse because of the color of my skin. And in those days, there was some benefactors of the hospitals that gave a lot of money. And so my assignment would get changed. And so that was just how things were at that time. It wasn't right, but it was just, as we say now, patients are clients and customers. And that was what we dealt with. And it wasn't just myself, it was whether it was nurses, care technicians, there were patients that did not want people that looked like us in their room.
Do you think representation could benefit the greater community?
It
Go ahead.
Yes, I think it definitely can. And at the time I felt confused. I didn't, I would call my mom, and it was hurtful a lot of days because, I worked hard to get to that point. And so I didn't understand, someone is in the bed sick, but they didn't want the help that I was there to give. So it was a lot of days that it hurt my feelings. I cried because I didn't quite understand, how could someone be ill and then they're at the mercy of someone that's genuinely there to help, and they didn't want that help. As time has gone on, of course, it's happened many a times over the years, but you learn to get a tough skin, and you learn to handle different situations where, as the years went on, they did not conform to those type of behaviors, and they would just let the patient know, this is your nurse, this is who's taking care of you, this is your team. And so now we do not, in this day and time, we don't conform to that type of behavior like we did over 30 years ago.
All right, so let's fast forward now to what does a typical day look like for you as a cardiac critical care nurse, and then also what parts of it are most rewarding, right?
I would say, and as an advanced practice provider and nurse practitioner, I do transplants and heart failure. So when a patient comes in with heart failure, and we are seeing patients with heart failure of all ages, they can range from early 20s all the way up to 60s and 70s. So when they land in the care of our team, it is an end stage care situation where we have to decide, is this patient a candidate for a surgical option, which means, are they a candidate for a heart transplant, or are they a candidate for a LVAD, which is a heart pump that will take the place of pumping the blood flow that the heart is no longer able to do, the left ventricle, because of the heart is weak to that point. Or does the patient and the family, do they want to just do what we call palliative care, and we have what we call inotropes or drips like milrinone and dobutamine, that they can get a PICC line and they can go home and live the rest of their life the way that they want to live, but not pursue any surgical options. So it's becoming, a patient population of this sort. It is very vast, and I think we've seen a bigger impact of patients that are younger since COVID, because of the viral illnesses, COVID, RSV, metapneumovirus, all these viral syndromes, love the heart muscle and they love the lungs because, and they have just really done a lot of damage to these organs. And so from that, I think that has affected a lot more broad range of patients. And a lot of genetics go along with that too. And that's where I think we see a lot of in the African American patient population, long-term hypertension. People have hypertension, they don't even know it. That's that silent killer that we talk about all the time. So they have high blood pressure, they're in, their kidneys are suffering from it, they end up on dialysis, so it's all of these under the covers that high blood pressure can affect, but the heart being the biggest affected organ. And so when we talk about hypertrophic cardiomyopathy, it's the heart is just nothing but a big muscle. So as it's working overtime with each cardiac cycle, the blood pressure during the resting phase, what we call diastole, you have a blood pressure of 130 over 80. So if a patient has a blood pressure of 220 over 150, 150 is like a systolic pressure. So just think of the heart is just working overtime with each heartbeat. And so over time, that heart muscle just gets bigger and bigger. And so it's just enlarged. And so that's why people end up with what we call, you have two types of heart failure. There's ischemic, which means the heart muscle is damaged from a cardiac event like a heart attack, or there's non-ischemic, meaning that it's from some type of viral illness or it's from high blood pressure or something that's not from what we call a heart attack or a cardiac event. So those are the two types of heart failures that we see and that we deal with, or it's just a genetic predisposition that patients don't a lot of times don't know of, but we do a lot of genetic testing to find out the reason why.
And so to that point, for you, when we think about um, those who want to be like you, right? What skills, what mindset, what mantras, what would you suggest? What advice would you give someone, person of color who wants to be like you?
Yeah.
Yeah, I mean, was there any mentorship along the way? Like, what? Give us your journey, give us the spiel.
I did. I would always, I had a lot of cardiologists that, I worked with back in Charlotte, even when I was, in nursing school and I graduated and ended up in the telemetry and the cardiac sector, that took me under their wings, and to this day, still have a lot of respect and communicate with them. Anytime I need a recommendation for, anything, I can reach out to those individuals, and they've always supported me, and they're African American cardiologists. And again, that's a very small percentage. That's growing as well too, but it's still a small sector of our reach and our care teams. Um, but they were very impactful, even through my device and industry world, they were very supportive. And even now, as an advanced provider, when I even thought about going back to school, it was nothing but support of, go as far as you can go. And then my parents, they both are deceased, but they were always very supportive. My siblings, it was always like a village of, whatever my dad always told us, whatever you have in your mind and whatever you learn, no one can ever take that from you. And so I always remembered that. And that was probably the foundation, the crux of no one can ever tell you no. They may be able to tell you no, but you just keep striving and you keep going. So any nurse that I see, and if they ask me, can you be my preceptor, and they're a current nurse and they're in nurse practitioner school and they need preceptors, I always try my best to, help or find someone to help them to fill their preceptorships, because it is hard and people don't want to be bothered because it is your time. But I always remember how hard it was to find preceptors when I was in school. And I always promised myself when I finish, I will always make sure I will help whoever asks me because I know how tough it is. So I always try to keep that sense of, paying back and moving forward because it is a tough route to go on, and just always supporting and encouraging. And even if they're like, I don't know, I think I'm happy where I am. I always just say, well, just think about it. We need nurses, but we need nurse practitioners too. And so I think I just always like to, look at my family and my parents and as the foundation, and then other clinicians that I met along the way. Um, Even in my industry world, there was one manager that I had when I first started in the medical devices, and she lives here in Atlanta. And I was like, "How am I going to teach physicians about this device?" And I was like, "I'm just a nurse." And she was like, "You are a nurse that have something that they want to know. So when you walk through those doors, you act like you know it, you own the room, and you don't ever let anybody tell you otherwise." And that was like the same advice my dad always gave me, or gave me and my siblings. So I never forgot that, and so even if you don't know it, she was like, you walk in like you do know it, and then you figure it out, or you text somebody or call somebody." And so I've always just kept that same sense about everything I've done my whole career, and it's paid off, and so I never walk in a room thinking that I'm not supposed to be there, and so that's the advice I always give everybody.
Seems like you've made a lot of sacrifices to get to where you have gotten to today. A lot of math, a lot of chemistry, a lot of blood, a lot of
Yes.
long hours, maybe some.
Math is not my forte.
Yeah.
That's like the worst. Oh my goodness, yeah. So I love science, but math is tough. It is definitely
Right.
tough. It is a lot. Yes, the statistics almost took me out.
Yeah. Well, hey, look, shout out to passing statistics. I know it
Yeah.
took a lot of people out.
Oh goodness, that
But
was the hardest.
uh, is it worth it? Right? Like all the years of studying, the debt, the long nights, the coffee, the tests, the 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 being one of the only chocolate chips in the cookie at work, right? Is it
That's
worth
true.
it?
A lot of times it has been that, but I think it has definitely been worth it. I would not change one step of my path, or the blueprint, as I call it, of life. I would do it all over again. I definitely would. I think it's definitely worth it.
Cindy, thank you so much for your time. Really appreciate everything you're doing for the community. And Godspeed.
Thank you so much.